Hi, Kristen Mangione for Zen Touch Studios. Talking to you in this video today about the connection between lower back pain and the season of winter and Chinese medicine. So in my previous video, I talked a bit about how there's this natural correlation in the winter season with either chronic ongoing lower back stiffness, tightness, or maybe you're experiencing this for the first time. And you may notice that the symptoms seem to get worse either upon waking, first thing in the morning, or sometimes after sitting for a long period of time, especially at your desk, stressful situation. So we talked a bit in the previous video about how this energetically is a peak time for this because we're in what's called the peak time for kidney energy. So now what I'm going to do in this video is talk a bit about one of the lumbar spine command points. This is from Chinese medicine, acupressure, acupuncture, and I use it in my own personal practice of shiatsu, which is acupressure energy healing, basically acupuncture without the needles. So by stimulating this point, and it's on both sides, right and left on your body, you can by yourself very simply begin to shift some of the energy, stimulate the nervous system to naturally create internal balance in your body the same way that we would in a treatment, so that you can help your body to help itself in righting itself in kind of this pattern that's being stimulated with discomfort based on the energetic predispositions, and then also maybe daily living things about having to sit at a desk for long hours. So how we're going to do this is we're going to go to what's called the Bladder Meridian point number 40, which is right behind the back of your knee, and it's going to be right in between the two big tendons in the back of your leg. And then once you find that, you're going to go ahead and just take your thumb and just simply bring your thumb right into the very soft spot, especially when your knee has to be bent, and you'll feel a little bit of give in that soft spot at the back of your knee. And just gently go ahead and put the thumb there and just either hold it, or you can even circle it just a little bit. You're gonna feel some of the soft tissue in that area around the back of the joint. That's okay as long as the knee is bent. You feel that there's a little bit of give in that space. And you want to just stimulate it for about 10-20 seconds or so, and then just see how that feels. Maybe a little sensitive. That's normal, especially if you're having lower back issues. And what this is doing is it's helping to actually release some of the tendency for muscle spasm or tightness in your lower back, because there's a connection. This is a trigger point for it, and so it's going to help to release it. And then once you've done one side, be sure to go ahead and do the second side as well, because this, like a lot of the acupressure points, are bilateral, which means basically that they mirror each other on the right and left sides of the body. And then again, for about 10 to 20 seconds, go ahead and stimulate that area, and then just notice how you feel. And a good rule of thumb with this is to do this upon waking first thing in the morning, and then also again before you go to bed at night, just as a regular practice, especially during this winter season, which is kind of a peak time for feeling symptoms like lower back pain. And then also too, if you feel like you're in an acute situation, in other words, if your back is particularly bothering you, this can be a very helpful tool that you can do even just sitting at your desk, in your office, at home, any kind of situation where you can just take a minute or two and just be off your feet and try this. So if you have questions, comments, contact our office, email us at info@zentouch.org. You can also reach me for personal consultations, more about this kind of natural healing therapies to get you aligned in better health, feel healthier and more powerful and happier during this season and every season. For Zen Touch Studios, I'm Kristen Mangione.